Hello, everybody out in Henry County. We thank you for joining us today and watching with us as we give you a healthcare update here in the month of April. We've got a couple of topics to discuss with you today, so let's get started and let's talk about what's at the top of the list on everybody's mind. That is COVID-19 and what's the state of the pandemic today. I've got a couple of statistics to talk through, so bear with me as we go through this. First, let's talk about vaccines. Henry County Medical Center has assisted the county with vaccines, of course. Thank you all for participating and joining in that with us and getting your vaccines. To date, our entire community has slightly under 17,000 vaccines that have been reported. That brings our county to a 30% of our population receiving a first dose vaccine. So that is an excellent percentage in our community. And again, thank you for joining in. The hospital is currently completing second dosages this month with Moderna. We sent a press release out earlier this week about J&J. The CDC has paused using the vaccine of J&J temporarily, and we're waiting to hear further instructions from them. So for J&J vaccines, that has been halted, and we just have those stored for right now. And we'll try to keep you updated with information from the CDC about that. As far as the pandemic, let's start with a worldwide view. And if you're checking things out on the internet, I look at several different statistics, and one of them is World of Meters. And from that, there's a couple of statistics that are kind of interesting. We saw a decline in cases from January through February. But then in March, as people are traveling and moving and making plans and just doing different things, we're beginning to see an upward track in the pandemic again. I think many of you probably see that on the news as that gets reported out. But something very interesting, 36 out of 202 countries, so that's 18% of countries around the world, are experiencing greater than a 50% increase in weekly cases. And if you look at the peak of cases around the world, that was around 845,000 cases back in early January. And as of April 9th, that total case was 795,000 around the world. So that's only 50,000 differences in cases. The one important thing is we're not yet seeing the full utilization of hospital beds again. So some of these cases are more mild. So we're glad to see that it's not just taxing on the inpatient side of utilization. The United States ranks third in daily new cases behind India and Brazil. And the United States ranks number one in cases and serious cases. Also within the United States, so let's bring that down to the United States from the world view now. As we look at Tennessee, we rank 14th for the number of new cases, 31st for active cases, and 15th for total deaths across the United States. Within Tennessee, Henry County ranks 72 out of 95 counties for daily new cases. So overall, while we're seeing cases surge around the world, and particularly in the United States, Henry County truly has a low rate of daily cases right now. We do rank, though, 22 out of 95 counties for a positivity rate. So while we have a low number of cases, our positivity rate is high. We are watching that and thinking that's more indicative of the number of patients who are testing. And if you think about it, if you had two people to test and one is positive, that's a 50% rate. So the fewer people who test, that may give way to a higher positive rate. That's just one way of looking at that. Another way of looking at that is if more people tested, you truly could have that percentage across your population. That's just the unknown in that when we look at that overall rate. So again, I think our county looks good from the standpoint of a low cases, the number of cases that we are seeing tracked through our facility, the health department, and other clinics. We are averaging about 18 tests per day in our county, with right at 3 new positive cases per day. Here at the hospital, we range from 2 to 4 COVID-19 positive inpatients. So please do know we still are seeing some inpatients that some of them are less severe, some of them are very severe and continue with respirator support services. So that's where we are with COVID-19. We are open for visitation here at the hospital. Masking is required. General visitation is from 9 a.m. to 9 p.m. You can please visit our website for very specific detail on specific areas with how many visitors can come at any particular time. And then also note that we still do not allow folks under the age of 13 to visit with us. And again, nobody has a crystal ball about the pandemic. I can't predict what is to come with this. All I can ask is let's please continue to be safe. Let's wear our mask, social distance, wash our hands, all those things. We do have the upcoming fish fry events next week. So please be safe during that event. It's a wonderful event. Glad to see that we can reopen and do these things as a community, because we did cancel that last year as a community. And again, glad to see that. Just please be safe and practice safe social distancing and masking during that time. Let's talk about now some of the new and expanded services that we have for you as a community. We do have Dr. Phillips is a new general surgeon that joined our community back in January, offering a broad range of general surgeries. His office is located with Perry Surgical. So please, if you need general surgery services, please reach out to him and know that we've added that, another physician into the surgical group. Pulmonary Rehabilitation is a new service that we are now offering to patients. This service is co-located with our cardiac rehab services inside the hospital, and it does require a physician referral. This program is a focus for the use of exercise and education to improve how people with chronic lung disease can improve their daily life. And we're finding that post-COVID-19, if you've been in the hospital or had difficulty with the pandemic or the disease, that sometimes you need therapy to help restore your lungs and the ability to breathe at ease. So please know that that service is there for you now, and utilize that. Secondly, we are now offering a expanded pain and spine clinic. So we're receiving patients for that service as well. This is located at the Kelly Clinic building. There are 2 options for you there. If you need a referral, Chris Gulish with Innovative Orthopedics welcomes patients. We'll be glad to see you. Please call his office for an appointment. If you see a provider of your own and are talking to them about your pain, feel free to have that provider call over as well and just refer you into the program. So either through Chris or through your own provider, that you could have access to our pain and spine clinic. The program uses physical therapy, psychological therapy, and interventional pain procedures to improve your health with pain. So we're glad to offer that. And feel free to check out our website and our Facebook pages. We have lots of information out there about that service. Our Wellness Center, which is also located in the Kelly Clinic building. This includes physical therapy, speech therapy, and occupational therapy. And we've added some new services for them. One of those is lymphedema therapy, and this is the treatment and management of swelling. We offer dry needling therapy, which is the treatment of pain and movement impairments. And we also offer a new line of pediatric sensory therapy. With that, we're using items such as a vestibular swing, climbing wall, chalkboards, all types of things to improve childhood development. So please check us out on our website, our Facebook pages for all those great new services. And we're so glad to bring those to you. We also have an upcoming focus on mental health for the month of May. Behavioral health was listed as one of our priorities by our community at the Positively Paris and Henry County Community Forum back in the fall of 2019. There are 1 in 5 people who suffer from mental illness. By comparison, 1 in 10 people have diabetes. It is a health need in our community as well as our region. And because of the stigma associated with mental health, sometimes many people don't receive the care that they need. We hope with our initiative and our focus on mental health that we can help reduce that stigma and provide all of you with the resources that you need. Our focus will be to discuss all the different available services that we have in our regional area available for you. Some of these are now available on telehealth. Some of these are available in an office location. Some of these are offered through the school system, just a multitude of different things, again, that are available when it comes to mental health. And so we will get information out, whether it's through videos, social media, various news avenues, and get information out to you so that you can know more about mental health and all of those different services. So stay tuned with us in the month of May to know about those great services. Lastly, I do want to tell you that we are a 4-star rated hospital. You can see this on Medicare Hospital Compare. They are updating that the month of April, and it will show that we're a 4-star rated hospital. Our skilled nursing facility, Pulmonary Rehab, at the healthcare center is a 5-star rated facility. So please know that we are offering you great and wonderful services, a broad range of services here at home. So all of these services that we offer are here right in your backyard at home. These are the highest ratings of facilities in a 70-mile radius. And I think there are about 17 hospitals in that 70-mile radius. And just want to tell you what a wonderful place that you have here in this community with the quality of care that we continue to build and to offer to you and all the services. So thank you for supporting us. Thank you for using us and choosing us for your services. So again, stay tuned to us to learn more about all of our services and the things that we're doing. Thank you for tuning in today, and be safe and enjoy next week's activities with the fish fry. Thank you so much.